Welcome to Healthcare Aptitude, where healthcare's thought leaders will examine ways to address the rising costs of care in America. We'll also examine how the latest advances in mobile apps are helping hospitals and health systems bend the cost curve and improve patient engagement.
Welcome to Healthcare Aptitude. I'm Tom Testa. During today's episode, we're going to focus on fast healthcare interoperability resources, or better known to those of us in the industry as FHIR. Specifically, we're going to answer the question, is FHIR mobile friendly? Joining me for today's discussion are Greg Jones, the Chief Technology Officer at MobileSmith Health, along with MobileSmith Cloud Development Team members Rachael Serur and Ed Clement. And finally, Chris Cook, who is part of the MobileSmith Mobile App Development Team. Folks, welcome. So Greg, we've got some great members of the MobileSmith Health team. Talk to us a little bit about this team you've assembled and their impact on both MobileSmith Health and the industry.
Yeah, I'm very proud of this team that we have. We have really smart individuals. They think further than just where today's technology is. We're always thinking about technology in the future. Chris, for example, Chris Cook, head of Android development, he's always looking into the new versions of mobile, how mobile can be used. Is there a reason why we need to stay native? Is there a better architecture that we should be using to enhance performance, productivity, all the things that me as a CTO want in a leader of mobile? And he definitely brings that. Rachael, she brings all the medical FHIR knowledge. She really, she's the watchdog for FHIR. If we're starting to talk generically about anything relating to healthcare, I can always rely on Rachael saying, well, how's that in FHIR? Or basically saying, well, we should be using this FHIR object. And it really helps immediately turn our discussions into healthcare and really what we're here to do to help patient services moving forward. I rely on her heavily. She also is really good with user experience. So we have some EMR integrated tools as well that integrate with Epic and Serur, for example. And she's really good at the development of those, not only the front end, building those out, but also awareness of everything going on in the back end. Ed he's the go-to guy when it comes to, we're implementing our own EMR for one-off solutions for hospitals that might have clinics that aren't actually integrated into their EMRs. We provide an EMR light, I would say, to use a phrase, version so that our tools can still be used for those clinics as well. And Ed is maintaining those FHIR databases on the back end. So I have a whole team that's really focused on security, compliances, awareness, future technologies, healthcare, everything a CTO wants. So yeah, I couldn't be happier.
Excellent. Well, this is definitely a great and accomplished group of FHIR experts we've got joining us today. So this is certainly shaping up to be an excellent conversation. Well, let's jump into it. Rachael, first question for you as we dive into the topic of is FHIR mobile friendly? Can you give our listeners an overview of FHIR standards?
So FHIR stands for Fast Healthcare Interoperability Resources, and it's a set of standards put out by HL7, the organization that comes up with healthcare standards for technology over the past 20 years and then some. And it provides a almost language agnostic data structure to strive towards and common resources that any given healthcare organization or application is likely to need to communicate. It's like the idea of a patient or a provider and the relationships between them. And it also kind of has a lot of standards that relate to how to communicate those resources across RESTful APIs, messaging, different service patterns, and they're also constantly coming up with new normative standards. Right now we're at release 4, but many applications and companies are still on DSTU2, which is the draft for standard of trial usage. And basically resources go through a series of vetting and voting from the committees and work groups on whether or not they should be integrated in the normative standard. So by the time a developer is working with these resources, you know that it can handle all kinds of different permutations of use case and architecture.
Yeah, and I'll just add, as a standard, it also supports multiple like data format standards for these different systems to use when they're communicating, as far as like XML or JSON. And she was mentioning resources as well. And if you think about the healthcare industry and all the types of data that are getting passed around between these different systems, such as, medications, or you have doctors or practitioners, devices, insurance claims, locations, there's like so much different types of data. And FHIR has a resource for each of these and provides sort of a standard way that you can format this data so that these different systems can communicate between each other. And it's also, I think, worth mentioning that these different resources can have relationships with each other. So you might have a hospital who has a doctor, who has a patient, who has a procedure. And there's ways that you can represent that data using the standard FHIR format.
Yeah, that's a great point, Chris. And as you and Rachael both alluded to, FHIR, a big part of this is all about interoperability in healthcare, which, as we all know, is something that CMS, HHS are trying to achieve. And a lot of healthcare organizations, a lot of healthcare stakeholders are working towards. And that's why I think FHIR is very important. Would you agree?
Yeah, absolutely.
Yeah, the key to any given FHIR resource is the idea that medical coding is kind of a first-class citizen in the data model that you're working with. So you might have different attributes that the developer can work with in the code, but ultimately you're inputting and outputting medical codes that can be communicated across billing, providers, hospital admins, and just clinical meaningfulness. It's just a way easier way to package this all and communicate it across totally different systems.
And Greg, were you going to add to that?
I was just going to bring up there are still some struggles with any interface that this team has to deal with is the different versions of FHIR and being on top of those. So normally, Chris, for example, has to deal with every year Google for Android changes or adds another version of Android out. iOS is the same thing. iOS 14 just came out, right? And the new watch just came out. Right. So we're always having to monitor the new versions of all this technology as well. I think that sometimes that's missed at the higher levels of just, it's just FHIR now. Everybody can talk to each other, which is completely true, except if we're only listening for, say, version 2 and not version 4 or the new version 5 coming out, then we might not be able to communicate as effectively. So Rachael and Ed have worked on kind of middleman as well as other parts of the services. So, for example, and I think, Rachael, you can talk a little bit about this, like some of the challenges that we have when we're dealing with having to maintain different versions of FHIR, just to ensure that we can consistently support different EHRs. Yeah.
So there's a myriad of ways you can kind of deal with this in your architecture, but the way we've come up with, we kind of have this, like you said, a middleman service where we can take in FHIR and also build ways to understand data structures that aren't FHIR at all, such as Epic's proprietary medical resources that they use in addition to FHIR. And we can map that over to a different version that we need based on the service or the client that's receiving it. We can use a mix of different standards if we need to, if the incoming data supports that.
So we just talked a little bit about, the basics of FHIR standards, but let's get a little specific here, especially for this audience. What's the current state of FHIR in regard to healthcare mobile apps? Chris, you want to start there?
Sure. So there's a lot of big names out there that have their own mobile solutions for healthcare. And a lot of these organizations are using FHIR as a standard for their solutions. You have names like Serur and Epic, Allscripts. There's providers. Duke Health is one that comes up often when talking about FHIR. And I'd say a big one as it relates to mobile as well is the Apple Health Kit uses FHIR. And so Apple Health Kit is a developer framework. It has tools and services that developers and manufacturers can use in order to make their apps and devices compatible with Apple's Health app. So here you have one of the biggest software companies in the world who's recognizing FHIR as a standard for healthcare and is using that. You also have some tools if you're trying to develop your own apps to use FHIR. There's SDKs and libraries out there to help with that. On iOS, you have things like there's a Smart on FHIR library and SDK. On Android, you have FHIR, that's HAPI. And I think even outside of some of these larger organizations, you're going to see some smaller app developers that are also using FHIR in their mobile apps. So it's definitely, it's being used in a wide variety of places out there for mobile.
Yeah, you mentioned how a lot of the big players are adopting FHIR. So would you say, in general, do you think it's widely adopted still, or is there still a lot of implementation adoption that's still needed throughout the industry when it comes to mobile applications?
I think anyone who wants to have a mobile app and wants it to integrate with healthcare services and healthcare data has to have a conversation about FHIR. So I think at this point, we have these big names that are using it and adopting it. And I think there's still people that are starting to have those conversations as well. I still think there's more to be adopted. I think FHIR in general has matured a lot over the years to where you have these big names like Apple using it. So I think it's just going to continue to increase in its usability in the mobile world.
Great. So folks, what knowledge do you need as organizations move forward with FHIR?
What do you guys think about the need to have more of the GraphQL knowledge and the GraphQL services?
I was going to actually bring up GraphQL, Greg, because it lends itself so well to the FHIR standard itself. You have the ability to form relationships between FHIR resources and objects, right? And with a RESTful API, you end up having to usually you request a single resource type at a time. So if you need to traverse a number of different resource types via those relations, you're making a number of different RESTful API calls, which, if you're running a web app on the desktop, not too big of a deal, but mobile tends to be more data limited, and people have come to expect things to be fast and almost instant on your phone. And GraphQL gives you that power, right? Because you could, in a single request, pull back all those different relationships between let's say, patient object, right? You could say, give me a patient and give me their providers, give me the organizations for those providers, give me their appointments, all in one request, and only request the fields that you want out of the FHIR object. So it limits the size of the data you're going to be pulling down. So I think that's really the future of FHIR, and it's something I'm excited about.
Yeah, I think a caveat with that is it takes so long for EHRs and a lot of the older medical software companies to adopt the newer standards. A lot of what's out there right now is in DSTU2. But with our group at MobileSmith, since we're working with FHIR already in so many different places, we can go ahead and set up a GraphQL API in between what we're getting from outside sources and then feed it into our mobile apps using GraphQL.
Yeah, I think that's a great point. When you're considering mobile, you have to consider how much data you're sending over, because someone could have a limited connection depending on where they're at. So you're not going to probably want to do something where you're having to show 300 patients and a bunch of associated data with that. It's probably going to work the best when you're showing maybe that one patient's data.
Great. So for healthcare providers looking to develop or purchase mobile apps, what advice do you folks have? Chris, you want to start us off with that?
Sure. Whether you're going to develop, implement, or purchase one, I'd say there's two things that are really important. And one of those, I think, is the standards being used for the solution and then the security behind that solution, especially when we're talking about healthcare and patient data. So if you're building or you're buying a solution, you're probably going to want to make sure that solution is HIPAA compliant, that the data is being encrypted where it needs to be encrypted, and that it's only being accessed by who it should be accessed by, and that you're following standards, especially when you have so many different health systems, that you're following standards like FHIR that can help these mobile apps communicate between these different systems.
In your world, the mobile apps they're very important, especially as providers are looking to purchase mobile technology. But I want to ask, what goes into it on the back end that's going to help deliver a great consumer experience?
Without a doubt, you're going to need APIs, whether it's RESTful APIs, GraphQL APIs. And if you're storing the data in FHIR, it's probably a good idea to either like you said, purchase your own FHIR service, whether it be, a platform as a service, software as a service solution, or roll your own FHIR service, which if you're going to do that, you're definitely going to want developers who are familiar with working with open source technologies, right? Because to develop your own FHIR server from the ground up is a crazy amount of work, right? So there's open source libraries out there and tools that have implemented the majority of the FHIR standard for the different FHIR versions. One of those being FHIR. Chris mentioned he uses the client libraries on the Android side to manipulate FHIR objects, right? Now, the back-end side, there's a series of libraries that you could stitch together to get yourself a working FHIR server. And obviously, security is super important, too, if you're going to build it yourself, right? You'll obviously want to think about security if you purchase something, but most likely there's already been tons of testing from whoever you're purchasing that from, whether it be a Epic, Serur, Smile, CDR, or whatever. But rolling your own, obviously, there's many concerns you have to deal with HIPAA compliance and just general security, right? Making sure data is encrypted on the back end, that your architecture is, proper, and it's just a lot of thought that has to go into that security piece of it.
Absolutely. You're listening to Healthcare Aptitude on Healthcare Now Radio, and I'm Tom Testa. Today I'm joined by MobileSmith Health team members Greg Jones, Rachael FHIR, Ed Clement, and Chris Cook, and we're talking about the mobile friendliness of FHIR. Ed, I want to turn to you here for a question on helping us understand why providers should be using mobile apps. Your thoughts on that?
Everybody lives on their phones nowadays, right? And they live on their mobile devices. And as a provider, they should be patient focused. And the easiest way to provide the info and data a patient needs and to be able to get data back is through a mobile app. So, the future of pretty much everything nowadays is mobile, right? Mm-hmm. Making sure that things are easily accessible all the time, and instant, right? That's what people have come to expect. So it's great having desktop apps and things like that, but the majority of patients, I'm sure, would prefer to be able to pull out their phone and do what they need to do on their phone and not have to sit down and log into a computer or, going even further back than that, make a phone call or visit in person, right? So it's making things more efficient.
Great. And Chris, I want to jump over to you for a second on, the provider use of mobile apps and the importance here. What functions would you say are particularly helpful?
When it comes to mobile apps, you have your device provides some built-in capabilities that can provide some interesting opportunities. You have, obviously, location is a big one. So we have the GPS stuff in there. You also have just the mobility of it. Everyone always has their devices with them. So you have your mobile app, and let's say you also have other devices as a patient. Maybe you have like a glucose monitor, or you have a heart rate monitor. Being able to have all that with you in a mobile way, and being able to use that to provide features or functionality to a patient are all good opportunities.
Right. And Rachel, I want to turn to you as well. Convince our provider audience. Why should they be using mobile apps if they're not already?
Yeah, we are increasingly all using our phones for just about everything. And as these standards emerge, the good news is we have big names, like Chris said, Apple and Serur and Epic, providing large chunks of data and state-of-the-art functionality to be able to pull in these different resources more easily. So when Chris is developing an application for a perioperative tracking events, he's able potentially to hook into the Apple Health Kit to get those metrics and then funnel them into our backend services where we can code them properly and either feed them right back to the EHR or find a different way to get that back to the provider. Medicine and healthcare technology in general is becoming increasingly decentralized, so the patient has access to their data at all these different nodes in the system, but at the same time, they should be able to, with just a few clicks, pull everything together. So when you're using devices, when you're using mobile applications, you're able to pull in all these different kinds of metrics. So that's so much data that you can feed through machine learning, try to predict different outcomes, tie it into their genetic history. The opportunities are really wild and exciting.
Excellent. Now, Greg, can you talk about, I want to start with you. What are some good use cases for FHIR when it comes to mobile technology?
So when it comes to reducing the amount of work that care providers have to do manually is one of the major keys to a successful solution and a successful partnership with any provider, I believe. Mm-hmm. So then how do we make sure that the technologies that the hospitals have already invested in can work seamlessly with the solutions that we are providing? Mm-hmm. And the ways that we have to do that is through a common set of data sets. And in the past, that used to be very difficult. HL7 made it much more streamlined. So having the ability to pull data from a patient, making suggestions to a decision maker so that a doctor can review that data, make good decisions on that data provided to them. That's really, at the end of the day, the key. Can a doctor spend almost no time absorbing and understanding a patient's medical data to actually take a second to be one-on-one with the patient and make good decisions rather than spending a lot of that? I think it's around 8 minutes that an average doctor has per patient. I believe technology can really provide a lot of advantage to that. How FHIR is very important is the more sick someone is, the more ill someone is, the more doctors they probably have, the more providers they probably visit. And so when you're going from one provider to another, that patient and their care providers are all having to communicate the same information to new decision makers and new doctors. And that itself can be kind of tiresome and frustrating. Looking at things from the patient's perspective, the patient should be able to say, here is my data, and you should be able to look at it. Now, that's what the near future, I believe, is really all about, is to allow people to be empowered with their data, to control that data. And I think that's kind of the whole use case of what we're really talking about here. The freedom for data to move from one place to another based on what a patient's health needs are. So FHIR is a great move towards that evolutionary change in healthcare data.
Great. Ed, Chris, Rachael, anything to add to that regarding what Greg said or use cases in general?
Yeah, jumping off the whole idea that the ultimate underlying use case is data accessibility, I would take that even further and say that the point of that accessibility is to support preventative medicine. You have all your data available and you have different data points that extend your care as a provider outside of the office, where your patient is continuously sending updates and checking in. And with that kind of data, we can prevent additional hospitalizations, potentially for some illnesses. For our perioperative app and MobileSmith, we're preventing cancellations for expensive surgery rooms and all the resources that go into that. And you're just increasing care and the quality of care. And with the way that healthcare is moving as far as regulations go, we're shifting from a model that incentivizes, financially getting more out of a patient revisiting again and again into a model that incentivizes recovery. And we're looking at different payment models and different ways for insurers to bring that to consumers a little bit better with providers. So in the end, FHIR enables that on a massive scale.
Absolutely. Before we wrap up, I do have one more question. So we may need to get our crystal ball out here a little bit, but in 2021, as you're all aware, payer, provider, organizations, hospitals, they're going to be required to provide patient access to their health information. This is all, mandated by the Cures Act and, of course, related to the CMS interoperability and patient access final rule. How might this new rule impact today's discussion?
Well, I think it will accelerate the adoption of mobile apps in order to provide patients with their data, right? That's going to be probably the most easily accessible way for a patient to get access to their data. Again, right, you can go to your provider and ask them for the printed out papers, or none of those are as convenient as having an actual mobile app.
I think that's the world we're inevitably headed towards. And if you're adopting technologies that don't provide that accessibility to the patient, then you're going to fall behind.
Yeah, I would just echo kind of what Rachael was saying, is that if you have solutions and you have patients using those solutions, where's your solution at now? And what is that going to look like in 2021? And are you going to be where you need to be for these changes?
Great. And Greg, how about you?
If anybody that's in like our world of MobileSmith Health, we start with that patient data. So that's FHIR. Mm-hmm. So now what doesn't FHIR provide? And we are getting into those very interesting conversations. For example, certain types of questionnaires, certain types of health trackers. We know that stuff doesn't really belong in the EMR. But if I'm in the EMR and I want to see that data maybe as a byproduct, or as a patient starts talking about it, they're like, look, I am doing exercising. So, and they can see health trackers, they can see wound care, they can see pain level tracking from remoteness, they can see heart monitors, glucose tracking. So now that I have that data available to me, this forces the next evolution of technology to say, okay, now that you have the data, what are you going to do with it? What kind of intelligent decision-making or suggestions are you going to be putting on top of that data? So it's always been, boy, I can make a lot of decisions if only I had the data. Okay, now you got it. Now what are you going to do with it? Are you going to make patients better? 36% of America has a chronic condition. How can you reduce that? How can you decrease healthcare spending now that everybody has access to their data? If they have access to that data and they have access to these apps, can you reduce the amount of people with chronic diseases, people that are waiting to go to the last minute to the hospital, hence healthcare spending increases? Can we reduce healthcare spending? Can we provide longer lives for people in an enjoyable way? So those are things that we can start looking into. Not only that, but if I have healthcare data, we can get out of talking about healthcare. We can start talking about mental health care. Having that data as the default entry, as the given, I think will really help spark a lot of creative solutions moving forward.
Well, that's all the time we have for this month's episode of Healthcare Aptitude. Greg, Rachael, Ed, Chris, this has been an excellent discussion. Thank you all for joining me today. Remember to catch the show on Healthcare Now Radio every weekday at 7 a.m., 3 p.m., and 11 p.m. Eastern Time. For more information, visit www.mobilesmith.com or send your questions to sales@mobilesmith.com. Thank you for listening, and be well.
Thank you for listening to another episode of Healthcare Aptitude, sponsored by MobileSmith Health. Be sure to tune in weekdays at 7 a.m., 3 p.m., and 11 p.m. Eastern Time on Healthcare Now Radio.